At Aviv Clinics, we also treat concussion and traumatic brain injury, or TBI, whether you're a retired professional athlete, an amateur athlete that had a concussion, or you were in the armed forces and you suffered blast injuries, or you just fell down the stairs. All of it is trauma to the brain, and that is something we treat here at the Aviv Clinics. We will assess what has happened to your brain. Often you might get a simple CAT scan and they tell you, oh, you're fine. But our advanced imaging will show the metabolic changes in your brain as a result of your head injury. You might be experiencing symptoms after that trauma to your brain. It could be headaches, confusion, brain fog, nightmares if there was trauma related to that head injury. In addition to the advanced imaging of your brain, you'll see our neuropsychologist so we can assess your cognitive abilities after that injury. You could be having memory loss. You could have processing speed issues, all of which could be affecting your day-to-day activities. Well, we want to measure it, assess it, and treat it so we can have improvements. Often when somebody has a trauma to the brain, they're focused on that initial event and immediately after. But long term, in addition to headaches or brain fog, you can have emotional changes too. People with trauma to the brain are more susceptible to depression, anxiety. It can change their day-to-day lives, and often they're ignored. But here at the Aviv Clinics, we look at the brain as a whole and how it relates to you and your life. We'll assess it with the imaging, we'll assess it with the cognitive evaluation, and our whole team will assess it from the emotional and psychological perspective as well. Our research shows that patients with traumatic brain injury have significant improvements, not just cognitively, but physically and psychologically. Every single patient that I have approved for the treatment with traumatic brain injury has had improvements in their life, in their cognition, and they notice it. Who is a candidate with traumatic brain injury? Well, almost everybody is a candidate. As long as you haven't had a pneumothorax, a collapsing of your lung, or seizures within the last 6 months, or you have active cancer, you are a potential candidate. The best way to find out is to see us, and you can schedule that by going to aviv-clinics.com. Our assessment process will ensure that every traumatic brain injury patient is somebody that we can actually help and treat. If I can't help you, I will let you know, and if I can, I'll tell you how. If you're suffering from TBI or concussion, it may be time for Aviv. Visit aviv-clinics.com to learn more.